Billing for chronic care management can be a challenge, but with Enable Healthcare, it's simple and efficient. CCM can be broken down into 3 core CPT codes, plus their add-on procedure codes. We'll walk you through each one step by step. First, let's talk about general supervision. And that's when services are provided by your staff under the direction of a provider, but the provider doesn't have to physically be present. They do need to make sure that training, oversight, and quality are in place. And with that, a trusted team member can perform the service, and yes, you can bill for it. Now, let's break down the codes. There are 3 CPT codes for CCM based on complexity and who provided the service. CPT code 99490 is your standard CCM billing code. It covers at least 20 minutes per month of non-face-to-face care delivered by clinical staff under provider supervision. This includes reviewing records, updating care plans, and coordinating with other providers or caregivers. The average reimbursement, it's around $62 per patient per month. Now, if your staff depends on more than 40 minutes, then you can bill for extra time using CPT code 99439. This code adds another 20 minutes per use, up to 60 minutes in total. So if your nurse spends up to 60 minutes on a patient, you'd bill 1 99490 and 2 99439. Next, CPT code 99491. This code is used when a provider, not staff, personally delivers the CCM service. To bill this, the provider must spend at least 30 minutes of time. And you can add another 30 minutes with add-on code 99437. These reimbursements are higher and they vary based on your location. Here are average reimbursement rates by a few states to give you a better picture. Now let's talk complex CCM. If a patient has 2 or more chronic conditions and requires more intensive care coordination with moderate to high-level medical decision-making, you'll want to use CPT code 99487. But before we can move on, here's a key reminder. Proper documentation is everything. Medicare requires records of time spent, tasks completed, and how it impacted patient care. If that's missing, your claims, they can get denied. Or worse, you could face compliance issues. So how do you stay accurate and compliant? That's where Enable Healthcare comes in. Our platform tracks billable time automatically. It logs tasks and services in real time, and it integrates directly with your EHR, so no more jumping between systems. We automate compliance, streamline documentation, and help you stay audit ready. Our real-time dashboards make it easy to monitor your CCM program and maximize your revenue. So if you're ready for less paperwork, more accurate billing, and better patient outcomes, take control of your CCM billing with Enable Healthcare. We make it simple.